So for the LAMP program, those were, we targeted them through our MedSync program as well. So as soon as I got that list, I put them on that and did the quarterly reviews and just was able to manage them that way. For the blood pressure program, I created a facility in our, we use Pioneer, and so I created it within Pioneer. And then our technician added all the different patients that needed their blood pressure taken into that facility. And then I added it on our labels so that whenever we check people out, they would see, the cashier would see on the label, it would say blood pressure. And so they would know to go get the pharmacist. And I trained all of our pharmacists to go over there and to talk with them about their blood pressure and kind of use the talking points that were given to us on EQUIPP for that program. We had a lot of success for people, and we would just say, hey, if you don't mind, can you come in for a second and we'll take your blood pressure? And then we had a lot of people who would return and want us to kind of check it out maybe a month later if it was high. So it really helped with our clinical services because they realized we're more than just dispensing, we're doing these clinical things as well. And so that really was a very successful program.
Welcome to the Pharmacy Quality Solutions Quality Corner Show. Buckle up and put your thinking cap on. The Quality Corner Show starts now. Hello, and welcome to a special edition of the Quality Corner podcast show. Today, I will be your host, Brittany Boyd, Associate Director of Pharmacy Training and Support. On today's episode of the Quality Corner Show, I have the privilege of interviewing Shelyn Davis, owner and pharmacist at Community Care Pharmacy located in Malvern, Arkansas. The performance of Community Care's pharmacy in 2024 calendar year has identified them as the most earned pharmacy within APCI under our new Pharmacy Stars program. Shelyn, we welcome you to the show.
Thank you very much.
Yes. We're very happy to have you. But for our Quality Corner Show listeners that are wondering, what's a Pharmacy Star? Well, I'm happy to announce that the Pharmacy Stars program is a new recognition program. We are here now to recognize the outstanding achievements of our community pharmacy partners. PQS by Innovaccer would like to celebrate the efforts of our end users as they leverage the EQUIPP platform to best influence their actions in the pharmacy. We will spend today's episode time getting familiar with Shelyn and Community Care Pharmacy ahead of the APCI convention, where they will be receiving their award that will be physically presented. So you're probably listening to this after the ceremony has already occurred. But again, please join me in congratulating Community Care Pharmacy for their efforts and their engagement with opportunities in 2024 that provided some additional revenue stream through EQUIPP into their pharmacy. So Shelyn, how does it feel to receive this award from EQUIPP?
Oh, it's amazing. I had no idea. I mean, I felt like we did pretty well, but there's lots of pharmacies out there. So yes, I'm very proud.
Yes, and we are very proud of you as well. So I'm very honored to be able to give you the first of its kind award. This is the first time that we're doing this, as I mentioned. So really excited to be able to present you all with this. So listeners, again, we are going to take this time today to learn more about Community Care's pharmacy. So we're going to jump right in here, Shelyn, and I'm interested to know, on average, how many patients do you and your pharmacy staff engage with on a weekly basis, and how many staff members make up Community Care Pharmacy?
We have 23 employees. I don't really know how many patients we see per week. We do over 1,000 prescriptions on Mondays and Tuesdays, and the rest of the week it's getting on up there. But I feel like we fill a lot of prescriptions, that's for sure.
Absolutely. And so as you mentioned, being the owner there of the pharmacy, how long has Community Care Pharmacy been open, and how long have you been an independent pharmacist?
Well, I started off as an independent pharmacist back when I graduated in 1990. Me and my mother opened a pharmacy. We sold to Fred's in 2005, and then I worked as their PIC up until they closed in 2018. At that point, I was born and raised in this town, and I had a following. So when they closed, I did not want to go to Walgreens. I just wanted to open my own store. And so we opened up, and within a month, we were filling prescriptions. Lots of times I didn't have the contracts yet, but we kind of did a cash basis only. And then in 2020, we opened up in our new location. And we've just done nothing ever since but grow. I mean, every month there's been growth. And I think my employees, of course, I started off with 6 that I brought with me from Fred's. And um, we just hunkered down and tried to take care of our people. There is a small town feel here. I know people; they know me. When Fred's was Fred's, it should have been Fred/Shelyn's because they knew who they were getting. And I work a lot of hours, and I like taking care of people. And EQUIPP is the platform that just makes sure that we get all our patients taken care of in all aspects.
Thank you for that, Shelyn. And so, as you mentioned, utilizing EQUIPP and the pharmacy staff that you have there that helps you work through that. You have 23 members, which is impressive, and the number of patients you guys engage with. So I love that you're there doing that for your community, and you've been raising through that. I know that you said you have a staff member, Samantha, your clinical pharmacist, that is working to really kind of optimize how you all were able to earn more. So would love to have a chance to chat with Samantha for a bit.
Yes, let me give you a little preface on her. So she was my pharmacy student. Actually, she goes to church with me. I was her children's chapel teacher back when she was 3 and 4 years old, but she wanted to go to pharmacy school. I got her a job at Fred's. Of course, then she moved to community care with me, and she graduated in 2020, and I knew I was just waiting. I really feel like I could have grown more in 2019, but I was just waiting on her to graduate. And she started EQUIPP back then, and she's never stopped with it. Well, Samantha is our quality champion of community care. She wants our patients to have the best care that we can give them. We're actually making sure, I feel like, that the doctors are doing that. But yeah, she's our quality care champion for sure.
Samantha Pennington, thank you for joining us today on the special edition of the Quality Corner Show. We've had a chance to learn a little bit about you and your background as a clinical pharmacist there at Community Care on behalf of Shelyn. So really thankful for your efforts and really excited to award Community Care Pharmacy for being the most earned because you all were working with your patients so closely in 2024 with those gap closure opportunities. And so wanted to kind of ask you, how is it been with utilizing EQUIPP for you at the store level? We hear often from pharmacies how challenging it can be with the other competing priorities you may have. So I want to know how that goes into your workflow, and then also wanting to know why it's important for you all to utilize EQUIPP.
Yeah, so I think something that really helped us with increasing our EQUIPP numbers was implementing MedSync. So we started that, I think, May of last year, and that's helped a lot. The patients that I targeted at first were our outliers in EQUIPP. And so I went to EQUIPP and looked at patients, downloaded that list, then kind of compiled who was our outliers in all the different categories, and then made a category in our computer system. And that's who we targeted at first to enroll into our MedSync program. And so that helped a lot, just kind of get these people adherent to their medicines. And then I've always tried to make EQUIPP and outcomes and all those different programs a priority, at least weekly, going on, checking the numbers, seeing how we're doing, and just trying to target these patients by like putting them in a facility so that I can talk to them about their adherence or any issues that they're having with their medication. We also recently we implemented a technician whose specific job is to help with these kind of programs. And so it really helps me be able to focus more on the clinical aspect and then focus more on the like a secretarial aspect of it, getting all the lists downloaded and put together for me in an Excel spreadsheet so that I can know who needs what and what I need to focus on. So that's helped a lot as well.
That is amazing, and really great to hear that, Samantha, that you guys have, your team members that are involved. Everybody has their action items, it seems like. And so having that level of actionable insight is going to be really important to drive what you all do actually see as a return. And so having EQUIPP, as a valuable data tool to you all, I know is really impactful in that. And so you've already shared that you have more than one staff member that's actively kind of working through that. You share it timely. You guys are doing that weekly, which is really great. So when it comes to the enhanced services opportunities that you all were engaging with in 2024, did you have was that same technician assisting you there? Was it you kind of primarily working through that? And what were the steps that you were taking to engage with those patients specifically?
So for the LAMP program, those where we targeted them through our MedSync program as well. So as soon as I got that list, I put them on that and did the quarterly reviews and just was able to manage them that way. For the blood pressure program, I created a facility in we use Pioneer, and so I created it within Pioneer. And then our technician added all the different patients that needed their blood pressure taken into that facility. And then I added it on our labels so that whenever we check people out, they would see the cashier would see on the label, it would say blood pressure. And so they would know to go get the pharmacist. And I trained all of our pharmacists to go over there and to talk with them about their blood pressure and kind of use the talking points that were given to us on EQUIPP for that program. We had a lot of success with people, and we would just say, hey, if you don't mind, can you come in for a second and we'll take your blood pressure? And then we had a lot of people who would return and want us to kind of check it out maybe a month later if it was high. So it really helped with our clinical services because they realized we're more than just dispensing. We're doing these clinical things as well. And so that really was a very successful program.
That is fantastic to hear, Samantha. And that is exactly the level of insight that we want to hear from our pharmacies. And you all being the most earned very much so clearly tells that your system seems to be working fantastic for you all. You would be what we would call a quality champion at EQUIPP because you are the one that is actively engaging with the staff to let them know what they should expect. So that is a clear way to incorporate into workflow, right? You're taking the data from out of EQUIPP. You all are using the resources that's been provided to you by knowing, hey, let's have a quick conversation about it, but taking it a step further by utilizing Pioneer and making sure that that note is available to that patient of, hey, they could use a blood pressure reading. So make sure that, your staff, everyone is well informed of like what to do, right? You don't see a piece of information and someone else does not have that. So it's really exciting to hear and to know. Now, because you all were able to take these steps, you were able to see a financial return based on that level of engagement there with EQUIPP. So are you all looking forward to the new financial opportunities that are going to come this year? And do you have any new goals that you want to achieve in 2025 with the enhanced services opportunities through EQUIPP?
Definitely looking forward to any opportunities. I've actually been logging in, looking to see, because I don't know whenever they're going to show. And so since the beginning of the year, I've been looking to see like what we qualify for, if we get any enhanced service opportunities. So definitely looking forward to it and just seeing what I can do. I really enjoy kind of the challenge of how to implement these things and put it into our workflow and make it a priority. So I'm excited to see what else we'll qualify for and be able to do. It's really been fun to be a part of both the LAMP program and the blood pressure program as well.
That is amazing. And like you mentioned earlier, right, that this is a clinical service opportunity. You're doing more than just dispensing for your program, for the programs and for your patients there in the pharmacy. So how did your patients, how did they respond to, taking an extra few minutes to get a blood pressure reading done? Or how did they feel about, the check-ins that you all were doing quarterly for the LAMP program? What was their response to that level of care you all were providing to them through the program opportunities?
They really appreciated it. We had an excellent response to both of the programs. Like I mentioned with the blood pressure, it was really a good opportunity for us to show that we were more than just dispensing pharmacy. And we recently implemented test and treat in our pharmacy as well. And so those kind of went hand in hand with showing our value and outside of just dispensing. And so that really helped with that aspect of it. So it was very well received by everybody. And a lot of the people, like I mentioned, had come in and wanted us to, if it was high, check it again, or to send the result to their doctor, or to just be a part of their health plan overall.
That's amazing. So when we think about that level of engagement, and like you mentioned, they're willing to return and have that interaction with you already. Again, because you've already had it with them already once. Shelyn had led into this a little bit that you guys, see fill about 1,000 prescriptions on Mondays, and it increases as the week goes on. So that means you guys are a very busy staff. You have, but you have the staff to help support that, and it may be shorthanded to where it gets pretty busy in the pharmacy. So from a time perspective, Samantha, if you could estimate, what's kind of the time for a patient journey or the EQUIPP journey itself? Like, how much time would it really take for a staff member to document the engagement into EQUIPP and actually complete the clinical service there in the pharmacy? If you could estimate a time to that, what do you think that would take you?
It's very easy to document. I think the hardest part is like getting that data to a place where you can utilize it. So once you have the data, documenting it takes like minutes. I mean, very, very easy to do. Now compiling the data, maybe like 30 minutes a week, or yeah, 30 minutes a week or so. I try to log in and look at that. And honestly, since they're broken into like quarters, you can look at the different quarters, or you can look at the yearly outlook. Even just, if something doesn't change within the quarter, you just have that data within that specific quarter. So you don't even have to look at it weekly, but that's about how long it takes if you really want to try to make sure you engage with the patients. And overall, it's super easy once you log in and have that data to put it into EQUIPP as well.
Awesome. And that's really great insight to have, that it's not taking you out of workflow, for too long or too much where it would interrupt, the standard dispensing practices that you would be conducting in the pharmacy. So that's really exciting. But, I want to ask you, and then I would also want to kind of ask Shelyn as well. But I'll ask you the question first. As the most earned pharmacy star, what is one piece of advice you could give to a pharmacy that's looking to increase their revenue potential through enhanced services within EQUIPP in 2025?
I think that it seems intimidating, but it's not. You just have to do it, and you just have to start somewhere. So just starting and figuring out what works best for your pharmacy, workflow wise, employee wise. Luckily, we have enough employees that I can have a technician who helps me a little bit. But just starting somewhere and just figuring out what works for you, and it's really easy to do. Just don't be intimidated by it. You just have to start it.
That's right. That's really great insight to have, Samantha. And before you segue back to Shelyn, I want to let you know that the enhanced services opportunities are set to return in the second week of April. So continue to check in every week. Don't stop with the process. Clearly, it's been, it's works for you all of making sure that you're tracking that and still engaging with the data. So you'll continue to see rolling 6-month updates. The true year-to-date data will update with the May EQUIPP refresh. But enhanced services opportunities to engage with should start back in EQUIPP within the second week of April. So really looking forward to premiering those opportunities back for you in the pharmacy.
Yeah, I'm excited. I'll be checking it in as soon as I can.
Yes, we love that. All right, Shelyn, welcome back. So Samantha gave us some really awesome insights to how you all are operating with the gap closure programs there at Community Care Pharmacy. And again, I just want to say how proud I am of what the success has been that you all have been able to instill, and the level of care you are providing to the patients that are there in your community. So again, as the most earned pharmacy star, I want to know from you if there is any advice that you want to provide to any of your other fellow pharmacy owners, pharmacists that are out there that are looking to increase their revenue potential through enhanced services through EQUIPP in 2025.
I think just having the attitude of this is what we're going to get done is, I don't know, 3/4 of the battle. That we are going to do it, that we are already doing it, so why not get paid for it? I mean, independents out there are giving great care, so just go ahead and go the extra little step and get it in the works, and get somebody that has passion for it, like Samantha has passion for it. We With all of my employees, I try to find what they do well and let them do it. And I've had one girl with me for 20 some odd years, and she's wonderful with the paperwork and I have her as my inventory specialist. And but Samantha has, a love for the clinical side of pharmacy. And so, I just open the door and I let her have as much reign as she wants with it. And I think that is one of the, I mean, if I'm successful, then that's the reason I would say I am, is because I have my employees, I try to find what they are good at and let them be good at it. And then we all treat ourselves like a family. We treat ourselves like a family. And so we've nicknamed it Pharmily, and PHARMILY. I'm sure somebody else has that too. But I started the pharmacy with the little pharmacy with the big heart. We still go by that. I don't feel like we're so little anymore, but I'm going to keep that little slogan for as long as I can. We do love our patients, and I know there are everybody at this APCI convention or wherever, they love their patients too. But getting paid for the services is just one of the things that we can really work on and make that a goal of 2025, is to really get paid for those services, so that when you go give Mr. Smith a hug, you know that you love him, but you're also, when you lost that 23 cents on his warfarin, that you're actually getting something.
That is amazing. A really, really great insight to have, Shelyn. I will do my due diligence in making sure to introduce you as the pharmacy with the little pharmacy with the big heart, because I love that slogan. And I love that you all have a Pharmily. I think that is truly insightful and amazing. I do not disagree with you that level of connectivity and just compassion that you can have for your patients really does go the extra mile. And to echo your earlier points, you are correct. You guys are already doing this work. You are already seen as reliable, clinicians there in your community. So why not get paid for it? And we want to empower you all with those opportunities. So kudos to you all for your efforts there. Well, Shelyn, it sounds like you have really instilled a really great foundation with your Pharmily at Community Care. And I love the big heart that you guys have, and you giving that back not only to your staff, but to the patients in your community. So again, on behalf of PQS by Innovaccer, congratulations on being the first most earned pharmacy in EQUIPP, and really excited to see you at APCI and give this award to you on behalf of your pharmacy so you could take it back to Arkansas. And again, just thank you for joining on. So to our Quality Corner Show listeners, thank you guys for joining us for this special episode today. And again, join me in congratulating Shelyn and the Community Care Pharmacy staff. We'll catch you guys next time. The Pharmacy Quality Solutions Quality Corner Show has a request for you. Our goal is to spread the word about how quality measurement can help improve health outcomes, and we need your help in sharing this podcast to friends and colleagues in the healthcare industry. We also want you to provide feedback, ask us questions, and suggest health topics you'd like to see covered. If you are a health expert and you want to contribute to the show or even talk on the show, please contact us. You can email info@pharmacyquality.com. Let us know what is on your mind, what we can address, so that you are fully informed. We want you to be able to provide the best care for your patients and members, and we wish all of you listeners out there well.